So tell me what's happening sexually for you now, both for yourself as a woman and how you see yourself, as well as when you're with your husband.
A generation ago, it was a question that might never have been asked. Now, as more women and men are surviving cancer, healthcare providers really do want to know, how is cancer affecting your sex life?
For many of us, sexual expression is really a part of who we are. It's life affirming, it's something that's joyful, it's the way that we express our feelings for our partner. So, while many people are not sexually active during treatment, it's certainly something that comes up again after treatment is over or in the survivorship phase.
Up to 80% of women and men who undergo cancer treatment experience some sort of sexual issue, from either physical pain or fatigue to a lack of sexual desire and erectile difficulties. And while chemotherapy, radiation, and surgery can all take a physical toll on the body, Dr. Ann Katz says it's not just the medical treatment that impacts sexual desire.
Psychological issues are huge. People often lose confidence in themselves. Their sexual self-esteem is impacted. So, for example, it's not uncommon for a woman who's had breast cancer and a mastectomy, for example, to really be reluctant to undress in front of her partner.
As a clinical nurse specialist and sexuality counselor at Cancer Care Manitoba, Dr. Katz has made it her mission to help patients cope with the reality of cancer. For instance, with over 200 types of cancer and varying treatments, there's a wide array of sexual changes that a cancer patient can face.
And for some cancers, they will actually be on medication for 5, 10, maybe 15 years after that primary treatment, for example, to modify the hormonal milieu in their body to prevent recurrence. And those will often have a very big impact on sexuality.
Quality of life studies show that sexuality typically ranks near the bottom of the list of pressing concerns among cancer patients in active treatment. However, once in remission or recovery, survivors say it takes on a greater importance for them and their partner.
Really trying to figure out, who am I now that I've had this cancer? What has been the impact of this on my relationships, on my intimacy, on who I feel, who I am, and my sexuality?
Not only is Dr. Katz focused on providing education and counseling to people coping with cancer, she's also helping healthcare providers get the conversation started with their patients. An internationally renowned speaker and educator, Dr. Katz is now writing her 9th book on the subject. But her most meaningful moments are in the day-to-day contact with her patients that she offers help and hope to.
Seeing the person who's been through this experience realize that there's hope, and this is not a part of their life that is lost forever. And sometimes, you see the light go on, and they understand, and they realize that they have a rewarding sex life to look forward to. Different perhaps, but rewarding. It's humbling, it's inspiring. It just really does fill me with gratitude.
At Cancer Care Manitoba, I'm Nicole Harris.